Healthcare saved my life. This one's important to me. I know healthcare touches each one of us as Canadians. It gives me enormous pleasure to introduce Victoria Ramirez, Senior Project Manager, UHN IT Transformation, and Dr. Socklingham to accept this award. Congratulations and thank you.
Okay. All right, good evening, everyone. Thank you so much for coming. Sanjeev is here with me today. I'm going to start by saying, true to this partnership, this project has been extremely important to myself as well as the clinicians that were involved. Sanjeev and I are both proud and honored to accept this award this evening on behalf of our patients and on behalf of our UHN community at large. Sanjeev has been kind enough to allow me to tell you a little bit of a story about our project. Before I start, I do want to send a sincere thank you to the panel judges. I can only imagine the difficulty knowing that the other contenders that were in this category who are also very talented. This project for me has been a labor of love for at least close to 3 years. And I fondly refer to it as the little project that could. Or, to frame it another way, the approach that we took on this project is start small, but achieve big. A few years ago, UHN made a conscious decision to look at advanced clinical documentation tools on a mobile platform. The ministry provided us with some funding, and we decided to focus all of our efforts on one clinic. That one clinic was a busy, ambulatory, and complex clinic, 5 health disciplines. This clinic was struggling. All of their charts were stored on site. There was no more room. We needed to come up with a solution. And our focus was not simply to digitally replicate our existing paper forms. Our goal was to transform the way care is delivered across the patient's continuum, create new paradigms, and really change the way we work and change the practice that we deliver in the bariatric clinic. As all of you who have worked on projects, you all know that there are good times, and then there are, I will call, the not so good times. And I'm going to share with you a story about the challenging and maybe the not so good times. And the reason I'm going to share it with you is that this one sticks in my mind to this day. During the project, we were designing tools for the psychosocial team. So this is a group of psychiatrists, psychologists, and the like. And we had put together a template. This was an iterative agile development process. And we worked very closely with the psychosocial team to put this together. Well, eventually it was ready to be unveiled. So we unveiled it together. And the feedback that came back was, this is great, but it's never going to work in our clinic. We appreciate the efforts, but it doesn't work in our clinic. And so, of course, as you can all imagine, I went home that night and it was quite deflated, but I was also thinking about, okay, they gave us lots of great feedback. We have to figure out, this has got to work. So the team went back to work the next day. And we put together the meeting of the minds. We looked at mental health models. We looked at best practices and standardized tools. And we also, which was I think the key to our success, is we decided that we needed to include some narrative components in the note in order to tease out some of those complexities. As you know, mental health is, that patient population has very complex needs. And so within 2 weeks, we developed our second iteration of our prototype, and I'm pleased to say tonight that the tool has been in use. It's successful, and the psychiatrists and the psychosocial team use it every day. In closing, I do want to thank a few people. First and foremost, I want to thank our bariatric patient population. They came with us along this journey for 2.5 years. They were patient, and then they persevered with us. There was a lot of agile development with them, and lots of back and forth, so they were patient. I'd also like to thank the clinicians in the bariatric clinic. Tonight we have with us Sandra, we have Rad, we have Sanjeev, of course, here with me, we have Susan. And so these folks were amazing champions, and there's a lot of clinicians that we owe a lot of gratitude that are not with us tonight. I want to thank the project team. This team embedded themselves into the clinic. We lived in the clinic for 2.5 years, and that's the way you work. We developed a trust. There was an alchemy between the project team and the clinicians. We trusted them, they trusted us. I also want to acknowledge from the project team, Andrew Gissing, who's standing at the back taking my picture. Andrew has been critical in the success of this project. He's my right-hand person. He never took his eye off the ball. He was the person that pushed the quality and safety agenda and also made sure the aesthetics of the application looked top-notch. Our in-house development team, the folks over in the left-hand side of the corner, they are all here tonight with us as well. And they amazed me day in, day out. They were able to overcome all kinds of technical obstacles to make this thing work. And they put first and foremost the patient safety issue, protecting PHI, which, as you guys can imagine, on a mobile platform, that's a challenge in itself. I'd also like to thank our development partner, SciLogic, who's also here this evening. They were always provided top-notch talent to the team and shared with us what a state-of-the-art iOS application needs to look like. To Lydia Lee, our CIO, I think she had to rush to another occasion. She was an amazing sponsor and support. To Michael Caesar, who's standing at the back, an outstanding leader in healthcare. He's always been a great mentor and guide for me. It was actually Michael that said, Vicki, you need to share this story and you need to put this submission together. And so I wouldn't be standing here tonight if it wasn't for Michael. And last but not least, my husband, Nicholas, standing at the back, who is really my guiding force in life. He's supported me through thick and thin, and he's made me the person I am today. Thank you very, very much from the bottom of my heart.
I just want to say one statement that I think this is truly a transformative experience and technological advance, particularly that we address two public health concerns of obesity and mental health. And so I do want to extend my gratitude to the team to address this and to UHN for investing in this integrated care model using this advanced clinical documentation tool. So thank you very much.